And in fact, if we look at what oxytocin does, by stimulating the production of oxytocin, you do all sorts of good things for your body. You enhance the immune system, you reduce pro-inflammatory cytokines in the nervous system and neurotoxicity. You improve the cardiovascular endothelium by reducing sympathetic activity and improving perfusion. It has impacts on the GI system by lowering inflammatory cytokines. It improves the musculoskeletal system. It stimulates the formation of osteoblasts in your bone marrow and the formation of chondrocytes, which improves your joints and improves your muscle mass. Oxytocin has beneficial effects on the renal system by improving glutathione levels and reducing inflammation. It improves the metabolic system, as I've already explained. It has an anorexic effect by its effect on leptin, and it improves the respiratory system. So there's lots of good reasons why having intercourse and having a flush of oxytocin may be beneficial in terms of our general health as well as cardiovascular health. And you know, if you ask men and women in older age, they will disagree with the statement that older people no longer want sex or have sex. A lot of older people want to carry on having sex, and I've got many men I've managed at the prostate centre in their 80s, late 80s even, and even 90s, who are wanting PD5 inhibitors to carry on having sexual intercourse. So what you're doing by enabling people to have intercourse is you're not only adding life to years, you're adding years to life. And it's health span, isn't it, that I'm really talking about, not lifespan. And you can see how delighted that lady is that I've treated the man and improved his erectile function. I do need to manage her as well, don't I? She needs topical HRT for vaginal dryness. She may need testosterone for desire. There are lots of things we can do to help the ladies as well. It's not just the men. So in the Tampere Aging Male Urologic Study, they looked at sexual frequency and the future development of ED. And they showed that intercourse once a week protected against the development of ED with a dose-response effect. So having sex actually prevents ED, another important fact. And physical activity protects against ED, as well as protecting against cardiovascular disease. And I'm sure that's by improving endothelial functioning. So cut down that sedentary time and take more exercise. So what effect does having sex have? Well, actually, it's equivalent to mild or moderate physical activity, such as walking 2 flights of stairs or walking briskly. It allows people to engage in both stretching and physical movements as well. And both those activities improve your endothelial nitric oxide synthase expression. So it improves endothelial function. And this is a 2016 study. It looked at the potential health benefits of sex with a regular partner, and it appeared to be very protective, especially in women. And sexually active women have a lower risk of cardiac events later in life. So I think I've made the point that we need to keep people sexually active, but is it safe for everybody? Is it safe for patients with cardiac disease? And how do we evaluate that? Well, the Stockholm Heart Epidemiology Program of patients who had a myocardial infarction, of whom 50% were women, found that those who are sedentary had a higher risk of myocardial infarction with sexual activity, relative risk of 4.4, than those who are physically active. So being sedentary after having a heart attack and having sex increases the risk of that sexual activity. So getting people to be active, really important. And patients want more information, because if we tell them the facts, it relieves anxiety, increases confidence, and alleviates fear. We can do this.